So, good morning, everyone, and a very warm welcome to the second webinar in our Life After Stroke series. It's just wonderful to have so many of you joining us today. And just to say that this is one of a series of events which is leading up to our first and our big conference on Life After Stroke, which will be held next year on the 11th of March. So I'm unashamedly plugging that and asking you to put that date in your calendar now. So I'd like, ahead of the webinar this morning, to thank the chair and the speakers. I'm very fortunate because I've had some of a preview of what's going to be said, and I think everyone will really take something away from this webinar this morning. I'd like to thank our sponsors who have been extremely generous, and it's because of them that you've got a free place today. So we are very grateful to them. We're also very grateful to our partner organisations who have endorsed and promoted this event. And of course, we would like to thank SAFE, who are the patient voice in Europe, who have really done a lot of the background work and organisation here. So we're really thrilled to bring this session to you. This is a difficult topic for many people, and we hope that this will help stroke survivors and their family to be able to raise questions with their health professionals. And we hope that this will help health professionals to be able to have those conversations. We do hope that you enjoy this programme, and you will see very much that the heart of what we do is around really promoting life after stroke for people who have had a stroke. So please, can I ask you to be an active audience? Please don't just sit there, really engage with us. You will see on the side of your screen that there is a chat function, so do post up chat. But please, if you want to ask a question, can I encourage you to use the question function? The problem is if you put the questions in the chat, we may lose them. Just one other thing, if you post a question, you have the option of pressing a button to make your question anonymous. So please feel that this is a free and safe space for you to ask questions that you would like to raise. In any case, even if you have posted your name, we're not going to read people's names out. So please do feel that you can ask questions that you really want to know the answers to. And please promote this event for us. Please give us some feedback and please post something on Twitter. And our hashtag is #LifeAfterStroke. So I'm only the warm-up act. I am the chair of the scientific committee for the Alliance, but I've got great pleasure in passing this session off to the chair for this morning. And that is Professor Anita Orsovska. Anita is a very eminent person. We're lucky to have her with us today. She is head of department for urgent neurology and professor of neurology in North Macedonia. Please do engage with this session, and I'm passing you over to Anita now. Thank you.
Thank you so much, Avril, for the kind introduction. I am honored and thrilled to be chairing this important session today on intimacy and sex, how to start the conversation. We will be hearing from Doug Youngson from the UK, who will talk about rebuilding love after stroke. Doug's presentation will be followed by a conversation between the stroke survivor, Diana, and psychotherapist, Dr. Anna Carvalheira. You can post your questions during the morning on the Q&A tab on the right-hand side of your screen. This can be done anonymously, as Avril mentioned, if you want to withhold your name. During the session, we will be posting links to useful resources in the chat function. As Avril said, please post your questions in the question function, not the chat function. At the end of all the presentations, we will ask our speakers to answer your questions from the two sessions we hear this morning. In addition, throughout the session, we will be posting links to support and information if you need any of these at this point. They will be available on the European Life After Stroke Forum website as well. And before I introduce you to Doug, our first speaker, I would like to take a quick poll. I would like you all to rate how confident you are right now about having a conversation about intimacy and sex. This is in the pulse function on your screen. And we will also take a poll at the end of the session to see if you feel the same after. So please do vote, and we will see the results before and after you hear the lectures of this webinar. And while you do the voting, I'm going to continue and I'm going to introduce you to our first speaker, Doug Youngson, who is a learning and development trainer with the Stroke Association in the UK. Doug has a master's in person-centered psychotherapy. He has 12 years experience of supporting people affected by stroke and brain injury through the Stroke Association helpline and his own counseling practice. Doug's current work focuses on training staff in the skills needed to have difficult conversations. He's passionate about rebuilding lives after stroke and believes that conversations about sex are an important part of this. So over to you, Doug.
Good morning, everyone, and thank you, Anita, for that introduction. So I've called this talk Rebuilding Love After Stroke. And I'd like to start by inviting us to just take a moment and think about what's really important to us on a deep level. So what makes our lives rich and meaningful? So you don't have to share what that is, just take a few moments to see what comes up. So if we do this, often our intimate, loving relationships will be one of the first things that we think of. And love, sex, and intimacy can mean lots of different things. We're talking about emotional intimacy, sharing our thoughts, our hopes, our dreams, and certainly sexual intimacy can be a really important part of relationships for us. But for some people, life after stroke can become about everyday survival, and it might feel like there's a big part of life missing. So when we're talking about rebuilding lives after stroke, sex, love, and intimacy are a major part of what life is all about. And if we can support people to rebuild these parts of their lives, then the impact for people's well-being and quality of life could be huge. So I'd like to share with you the thoughts of Jenny Plum, who has spoken about her experiences of love and sex after her stroke. And I think this quote highlights how central these things are to who we are as a person. So here's my story so far. As Anita said, I trained and worked as a psychotherapist and on the Stroke Association helpline. And I now train colleagues to provide support after stroke. And I was asked to come and talk about sex and intimacy at the SAFE conference in 2019. And was a bit apprehensive about standing up in front of a room full of strangers and talking about sex. But the more I researched and the more people I talked to, the more important it seemed for us to be having these conversations. And I spoke to someone who had struggled for 6 years with sex after stroke, when a simple conversation could have helped. And so I came back from this conference and started having more conversations and running workshops about sex and intimacy at the Stroke Association. And what I'm going to share with you in this talk is insights from these workshops and my own experience. And I hope that this will help people to talk about sex, love, and intimacy, whether they're personally affected by stroke or support stroke survivors and partners. So I'm mainly going to be talking from my perspective as a professional. This talk will include tips for healthcare professionals. But it's important to say that if you're a stroke survivor or a partner of a stroke survivor, I don't think you can really get these conversations wrong. So whilst it probably will feel quite awkward to talk to a professional about sex, their job is to help you. They're on your side. So any way you feel comfortable talking about this is completely okay. It's then up to whoever's supporting you to work out the best way to help. So the Stroke Association have done some research into sex and intimacy, and here are some key figures from that. So this first statistic perhaps isn't too surprising, given how life-changing stroke can be. 57% of people agreed with this statement. So if the healthcare professionals here think about how often we're speaking to people about sex, is it with 57% of people? If it is, that's fantastic. But I found that often people aren't talking about sex, which means there could be lots of people struggling with this on their own. And we know that a major worry for people is having sex again after a stroke. And current UK guidelines say that it's extremely unlikely that sex would cause another stroke. But in reality, it can take people a lot of time and work to feel comfortable and safe enough for physical intimacy. So here are some thoughts from our workshops. And our colleagues really welcomed the opportunity to talk about sex in the workshops, felt more confident to have these conversations. And several people reflected that this conversation is something very, very valuable that we can all offer. I'd like to just draw your attention to the final comment on this slide, which highlights how important it is to ask about sex when we might assume that someone isn't interested, perhaps because they're single, or they're an older adult, or they're disabled, or in a care home. And one person who I spoke to shared that she'd realised someone she had been supporting was probably hinting that they had questions about sex, but she hadn't picked up on that at the time. Therefore, a key tip is just to be mindful that sex might be something people want to talk about. And if we listen out for thoughts like the ones we see on the slide here, it might be that a bulb goes off in our head and tells us that perhaps a conversation about sex is going to be helpful. And this can give us an opening to start a conversation if we follow up on these sorts of thoughts. But we all know it can feel really awkward to ask people about sex and intimacy. So I'd like to share some practical tips for taking that initial step. So firstly, just starting with what we know, talking about sex can be part of a natural conversation. And if we're used to asking people about other aspects of life after stroke, we can ask about related things first and then bring the conversation around to sex and intimacy. So for example, we might ask, are you in a relationship? How are things with your partner? Are you close physically? Do you have any concerns about sex? It often feels easier to mention sex in the context of other things. So we might include that in a list of things that we're able to help with. Or questions about sex might become part of our standard assessment or review procedure if they aren't already. And often it might be that our role is simply to let someone know that they can talk to us about this and leave the door open for a later conversation. And if we can do that, that means that people aren't struggling by themselves. So here are some phrases to add to our toolkit. Acknowledging that sex is something lots of people have difficulty with is a good way to start a conversation. We'd also aim to be led by the person we're supporting and ask questions to find out what's most important to them and what they think might be helpful. So with these sorts of questions, we're not being intrusive. We're simply giving people that opportunity to talk. And it's good to practice saying that we don't know when that's the case. But it's probably not just a case of saying, let's talk about sex. There are challenges and every situation's a bit different. Sometimes we might need to think on our feet. Communication difficulties are often a big challenge when we're supporting stroke survivors. And we know that everybody's different, but there are some things that can be helpful for lots of people. Having a picture or a symbol chart that includes questions about sex and relationships is a good tool for communication. And also a good way to start a conversation and show somebody that this is something other people want to talk about as well. There are different views on at what point in the stroke journey is it best to be talking about sex. And some people won't even be ready to think about it. They may be coming to terms with the impact of theirs or their partner's stroke, with changes in their body or roles and relationships, or they may just be extremely tired. And one thing that can help is just to take away the pressure and focus on simple things that people can do that make them feel loved or make them feel like a couple. And we might need to set aside some time for that, which can be a bit of a balancing act. But sometimes when we hear the word sex, we might assume that we're just talking about penetrative sex and orgasm. And that definitely doesn't have to be what sex and intimacy is all about. And often the questions that people seem to most dread are those technical questions. So things like, can men take medication for erectile dysfunction? Is masturbation safe? What positions can people use? In fact, these are often questions that do have relatively simple answers. And many of these issues aren't specific to stroke. Often a doctor or a GP will be best placed to help, or we can refer to the guidance for our country. The most important thing to remember, though, is that we don't have to have all of the answers ourselves. So often with these kinds of conversations, we have this fear of opening up a can of worms. But often all that's needed is a bit of communication. So I'll give you an example. I worked with a colleague who was feeling stuck with a couple that she was supporting. And the stroke survivor's sex drive had changed since their stroke. Their partner was finding that difficult, and my colleague wasn't sure what to suggest. So we discussed it, and she sat down with them and talked through how they both felt. And after this, they felt as though they were on the same team. And although that problem hadn't gone away, they could manage it better as a couple, which made a difference to their quality of life. So often when we're supporting people with sex and relationships, one of the first things that we'll ask is, have you spoken to your partner about how you feel? And quite often the answer will be no, which might seem surprising, but if we think about our own experience, we often find it really difficult to talk to our own partners about sex. And that's not specific to stroke. Also, stroke doesn't happen in isolation. There are often difficulties in relationships which predate a stroke, but affect how people feel about sex, love, and intimacy after stroke. So one of our key roles, if we're supporting people, may just be to help people have those conversations with each other. But there are also times where some extra information is going to be really helpful. And it may feel harder to start these conversations if we don't feel like we have all the answers to back that up. And that makes things difficult because sex often isn't discussed in training or team meetings. But there are some fantastic resources out there, and we can learn a lot by talking to colleagues, and most crucially, by listening to people like Diana, who have shared their personal experience in sessions like this one. So I'm going to share some resources which are UK-based, but will be valuable across the world. And I hope that this session inspires people to talk to their colleagues about sex and find out what support there is in their country as well. Also, this isn't a one-off conversation. It's important to revisit this on a regular basis if we're going to get comfortable talking about it and make it part of our day-to-day work. So these are some resources which can be very helpful for people affected by stroke and professionals. The Stroke Association's research and guide on this topic has insights and practical guidance. Different Strokes have some great practical videos, and there are resources like Relate and the Love Lounge, which have loads of articles on relationships, sex and disability. And the Sexual Respect Toolkit is an interactive resource specifically designed for professionals having these conversations. So well worth checking these out. and links to all of these will be in the chat. Finally, in our research, we asked people if they agreed with this statement. And 35% of people said yes. So although we've got a really long way to go here, there is hope that not only is it possible for things to be okay with our relationships after a stroke, but things can actually be better than before. And if we can communicate with one another and face shared challenges together, this isn't just good for life after stroke, it's good for all relationships. Thank you.
Thank you so much, Doug. That was really amazing. It was a very interesting presentation, very educational and very useful one. And now I would like you to introduce the next session, which is a recorded conversation between Diana von Kramos and therapist Dr. Ana Carvalheira. Diana was 34 years old when she had a stroke. She has had to adapt her life after stroke and was involved in the creation of the first Portuguese Association of Stroke Survivors. Dr. Ana Carvalheira is a psychotherapist and sex researcher and former president of the Portuguese Society of Clinical Sexology. Ana and Diana, over to you.
Hello, Diana.
Hi, Dr. Ana.
How are you today?
Nice to see you.
Nice to see you again, Diana. And it's my pleasure to be here with you and share this moment with you. And I thank you so much for being here and sharing with us your own experience, right?
I'm kind of anxious because it's my first time, and because I think it's a big responsibility to bring such a big issue and an important issue for stroke survivors, like is intimacy and sex. So I'm kind of anxious, but I think we'll do it okay. We'll have a nice conversation.
When did you have your stroke?
It was in 2011 in June, on my wedding anniversary. It was my 12th wedding anniversary. I had a surgery, and after the surgery, I kind of felt bad with a bad headache. I was losing my strength, and I suffered a stroke. I was only 34 years old.
So young.
Yes, it was a terrible thing to happen to anyone, but when you are 34, I was investing on my career. I already had two children, one with 9, other with 7. And I have a happy marriage, but it was very difficult to struggle first to live, and then to get back, to get up again, and to do things by myself, and to be independent. It was, it has been, it was not was, it has been, because I'm in rehabilitation since then.
Diana, intimacy and sexuality is a very private topic, and I thank you very much for sharing with us your own experience. And I would like to ask you about your experience with your body changes after your stroke.
When you suffer the stroke, it's not the first thing you think. It's obvious, but when you initiate a rehabilitation program, and when I had the opportunity to come out the hospital and visit my husband in my family at home, and you miss those little things like a hug, a kiss, feeling a woman. It's all of that you are missing, feeling beauty, feeling sexual. Okay, and it's an important issue, and I kind of feel I didn't know how to bring the topic when I was talking to my doctor, but I know it was an important topic. So first we talked about it with my husband. We talked about it because I was afraid of suffering, of having another stroke. I thought that maybe in the act, in the sexual act, I will feel bad and suffer the stroke. I don't know if anybody feels like that, but it was my first fear was suffering another stroke in the relation, in the act.
So you are talking about your feeling of attractiveness. If you feel less attractive after the stroke, with your body changes, right?
Yes, it's true, doctor. Now that I think of it, I wasn't feeling totally woman. I was feeling like a young child who needs help to do his. I needed help for everything. In the first days, I was using diapers, and it was my husband who changed me the diapers. So there is no sexual impulse in changing diapers. You understand it?
Yes, I do. It's a turn off. It's a huge turn off, right? So I imagine that your eroticism suffered a lot. You are saying that you feel like a child, but in a woman body, and there are a lot of changes that you have to deal with, and it may have a very it's impact your sexuality, your attractiveness, and also your eroticism, because suddenly there are a lot of turn-offs that interfere with your
changing the diapers. It's a terrible turn-off. But for instance, in the first days, it was him that gave me back. That is not a turn-off. It could be an erotic trigger, because you are standing on the bathtub, and it's good to feel somebody that you love touching you and washing your hair and putting you soap. It's good to feel the touch. But for instance, when you touch yourself after a stroke, it's a different touch, because your sensibility is not the same. You've got, for instance, if you've got hemiparesis, that is my case. I don't feel the left side, the same side. I feel the right, and it was like I was touching my left side, but my left side wasn't here. I was off Diana. I was off a woman, and sometimes I feel pain. I experience pain when you hug, when you touch the arms, and it's difficult to explain, but I think it's all relation with spasticity, which is a sequel of the stroke survivors. I think, I don't know, but I think it is.
Yeah, spasticity, it's a topic that it's important regarding sexual arousal. But I would like to ask you first, about your intimacy with your husband. It looks to be you look to have a very good intimacy with your partner. So how you overcome the difficulties, it also depends a lot on the level, on the quality of your intimacy with your partner.
Yes,
right?
Yes, I have a fantastic partner. We are together since we were young. I was only 15, he was 18 when we met, and we started dating. So we were both very young. We have been growing together and experience um, all, uh, all what is to experience in sexual life together. And when I suffered the stroke, it was like getting to know each other from the basis. Okay, he was afraid too because he didn't know how I felt. I was on a wheelchair. He didn't know if it was good for me to be on the bed with him lying on me. Um, we had to learn we had to learn how to love each other from the first point. Okay, I remember the first weekend that I could get out of the hospital. I was in a rehabilitation clinic, and sometimes on the weekend we could come home. And in that first weekend, our children weren't here, were on summer vacations with my parents. And he prepared all the romantic scene for me because I was very anxious, because I was like a young teenager who was in a in her first time. Okay, so we went to dine out, went to see the sea. We have a nice talk, and then we went to a quiet place. It was not our house; it was an hotel, and it was a very intense and beautiful moment because it was the first time that we look at each other how I was, because I in that time 10 years ago I wasn't moving all my body. Okay, even my right side was not as good as it is today. I had very difficulties to lie on the bed by myself. It was him that helped me getting off the wheelchair and then sitting on the bed and then lying. And it was I can say that we cried. We cried together because it was very intense, and it was after you suffer a stroke, you think, shall I live? Will I get the chance of being happy and feeling a complete woman again? And then when you have the opportunity to be with the one you love and to understand what changes in your body occurred after the stroke, you started to get a new intimacy, to get new concepts of being sexually happy, and it's a great journey.
But you are giving a huge contribute, a very positive contribute for all stroke survivors who are listening from you, because you are sharing with us in a very genuine way, Diane, and I thank you so much. And also because you are having a very rich, very positive journey, and you have been putting a lot of effort along your own journey to improve your sexuality and to take the best and to rebuild a very good eroticism and intimacy with with your partner. Diana, I know that you got pregnant after the stroke. I would like to ask you about how did you experience your pregnancy after the stroke?
It was a real blessing because I got pregnant. It was not 2 years after the stroke. I've it was we were in June June 2013 when I discovered I was pregnant. And when you feel like your life ended up and it was not possible for me giving birth another human being, you discover that you have a little baby developing inside you, and it's the climax of the relation with between a couple, and it was a very happy moment of our life, not only for me and my husband, but for all the family and that supported us, and friends that were with us and that were experiencing how did we fight to don't let the stroke end with our marriage and with our life. It has been a real struggle to get up again and to fight stroke.
It's incredible, right? Because when you thought it was the end of your life, it was the beginning of a new life.
Yes,
that was being generated inside of yourself.
Yeah,
it might be a huge experience.
Yeah.
So Diana, I thank you so much for sharing with us your own journey in the path of intimacy and sexuality. Thank you so much.
Thank you.
Thank you, Diana and Anna, for such a warm, frank, and open discussion. I think everyone in the audience is moved to tears, including myself. So I really congratulate you on your bravery and your courage and your openness to share your story with us. And so, dear participants, I hope that you have found the sessions this morning very useful, very interesting. All our sessions this morning will be made available on demand at the end of next week on Life After Stroke Forum website, including a longer discussion video with Diana and Anna. So now I would like to start the question and answer session. Thank you all for sending your questions to the panel. Please continue sending through your questions until the end of the session. If we do not have the time to answer the questions right now, we will do so after the session closes, and this will be added to the Resource Center on the forum website after the event. Now, I would like to invite our panelists back, Doug, Diana, and Anna. So everyone, it is now time for questions. So thank you so much for your presentations. They were really amazing. And I would like to remind the audience to put your questions in the Q&A box and not in the chat function. And remember, this can be anonymous if you wish. So, dear speakers, if we have a lot of questions coming through, please keep your answers short and concise as possible. And I will start with a question to Doug. So, Doug, how do we have conversations about sex over the phone or video call, given that many conversations are remote since COVID-19?
Yeah, thanks, Anita. So this is something that we're talking to our colleagues a lot about at the moment. A lot of our contact with people we support is remote. and we might assume that actually it's more difficult for people to feel safe to talk about these things over the phone. But actually, it can be that because people don't have that person right in front of them, they actually find it a little bit easier to talk about what they want to talk about. And so particularly phone conversations can be quite intimate quite quickly. So that's certainly something to be aware of. We would suggest being really aware that we don't have those visual cues, and we don't know exactly what someone means when they're using words like sex and intimacy. So just to be reflecting and asking open questions to check out with that person what they mean as they're talking. And also just being aware that that we can't see someone's environment, so we don't know if perhaps they're in a situation where they don't want other people to overhear this conversation. So particularly if we're making an outgoing call, just checking that that person is in a place where they're okay to make that call.
I have another question for you, which is also open to other speakers. How do we involve partners in conversations about sex?
Okay. So yeah, I mean, I would say do. All of the things that I talked about in my talk very much apply to partners. I mean, one thing that some of our colleagues find helpful is to arrange appointments so that we have some time with each member of a couple individually and then together, so that people can talk about things that you know, that maybe they feel more comfortable with talking alone, but you know, also the context of that relationship is so important in stroke, and particularly when we're talking about sex and intimacy. Working with that couple together to manage things is really important.
Dr. Anna, maybe you would like to add something to the question?
I was thinking about the importance of sharing, the partners share with each other each other needs, and it's not so difficult to show up with this topic. What are your own needs and what are mine? And this sharing is interesting. Needs related to intimacy and to sexuality, sexual activity, but sharing the needs of each other. And trying to know, to acknowledge it. It's important because most of the time partners have no idea about the other needs.
Thank you. I have a question for Diana. When looking back to when you had your stroke, whether there are any resources or conversations with professionals that you think would have been helpful?
Hello, good morning, everyone. Yes, it is true. When I was on the hospital, I tried to talk with my doctor about having sex with my husband and having intimacy with myself too. And I got no answers because I think health professionals, I don't know, but they aren't prepared to talk about it with a patient. Okay, they are there to cure the stroke and to see how is our rehabilitation, but to talk about intimacy, to talk about how I felt with my body, how I was seeing my women's side, it was not easy.
And how did you start the conversation with your husband and told him how you were feeling?
We met each other when we were a teenager, so we are very close to each other. We are growing up since I don't know when, but I was feeling kind of strange, and he he discovered that he noticed that I was feeling strange with myself, and it was him who asked me why I was not feeling natural, why I was not feeling sexual appealing. Okay, I don't. Sorry about my English. I'm kind of nervous, and it's difficult for me to speak in another language different from mine. So forgive me if I couldn't give the right words, but it was like that because when you are feeling excited, but you are afraid of suffering another stroke, of not feeling sexual appealing for your partner, you kind of repulse it. Okay, you say, no, not today. I don't want to have sex today, or I don't want to think about it. Okay, but it's not true. You want to think about it, but you are afraid, and it gets it's kind of difficult, but you have to give time to yourself to experience a different intimacy with yourself, and then experience a different relation with your partner. Okay, sorry, I don't know
No, it's
if you
perfect.
understand it.
Yes, it's perfect, Diana. Thank you for that. I have a question for Dr. Anna. So we heard from Diana today about her story, but what is your advice to healthcare professionals here today? How can they start the conversation with stroke survivors?
Thank you, Anita. It's important. It's a very important topic, and I thank you very much for the invitation. It's a pleasure to be here with you today in this webinar. My advice to healthcare professionals are to not neglect sexual health of people. Sexual health is an important dimension of general health, and medical doctors are the first line for patients. So do not neglect, do not forget about this. And there is something very important. I do understand the difficulties of healthcare professionals because, first of all, they may not feel prepared to this topic because it's not in the curriculum of medicine career. But also because it's private, it's multidimensional. There is a lot of psychological content over there. But there is something that a healthcare professional may do, is listening, is to facilitate, is to make room for the conversation and listening with attention. Is an active listening with presence. Because a lot of times people want to be listening, want to talk about this. Okay, so listening is not difficult, and it's very, very important. And I also would like to say that it's possible to create a conversation, to start a conversation. For example, by asking directly. Well, Doug said already a lot about it, and I agree totally. But I also think that sometimes we may ask directly. We may explain to the patient that there are sometimes, or most of the times, there are psychological difficulties, relational difficulties, and sexual difficulties that may cause embarrassing feelings, shame, frustration, a lot of doubts. So healthcare professionals may ask directly about difficulties, possible difficulties with sexuality. Do you have any concerns about your sexuality? But there is also another aspect that I would like to highlight here, that is to give permission. The doctor may give permission to sexual activities, to sexual behaviors. as well to not have sexuality at all. So sometimes people need the permission of the doctor, of the healthcare professional, to have some activity or related to sexuality or not. Diana also talked about sexuality as solo. Well, we are talking about sexuality in a partner, but some people may not have a partner, but they are still sexual and they still have their sexuality, women and men. So the doctor may give permission to do that. I think that would be my main advice. A last one: when we don't know, and sometimes we really don't know, as Doug said, we may assume it with honesty, and we may refer the person to a sex therapist, to a psychologist with the clinical sexology experience. That's very important. So we can refer to another specialist because this is multidimensional, right? And a stroke survivor needs different help of different specialists, right? So the sex therapist may be included in the team.
Yes, thank you very much. And I think there are obviously huge gaps between countries where this part of the stroke survivors' lives is not at all addressed because there are no healthcare professionals who actually deal with this very sensitive part of their life. And so you partially answered one of the questions that were put in the Q&A section. So the question was, what do you do if the doctor or therapist or a nurse that does not know the answer to your question? So where do stroke survivors go actually? So obviously if the country does not have this kind of specialist, that it is very difficult for them to obtain any advice. How can they help themselves and help actually the whole family? And also another question said, would it be useful to improve recovery intimacy by having access to relevant accounts or narratives? So I think Doug or Anna, you can address this as well, and Diana, if you would like to answer.
Yeah, so I totally agree with everything Anna said, and I think particularly about sex and intimacy being multifactorial. You know, there's so many different elements to it, and I would say if the first person that you speak to doesn't have the answers that you feel you need, don't give up. And where to go next kind of depends on what the issue is. So, I mean, an occupational therapist or a physiotherapist may be able to give advice about things like positioning to manage arm weakness or spasticity. Continence nurse may be able to advise with issues around that. And quite often, I think as stroke teams, people who support stroke survivors, there's kind of little bits of knowledge and skill in different places, and it's just a case of people working together to communicate and find the best solution. But I mean, quite often as well as it is just having a conversation and talking it through, and sort of feeling okay to experiment and try things out, which actually can be quite fun sometimes with these things. So that's what I would say. And I mean, the question about accounts and narratives, yeah, absolutely. That sounds fantastic. So, and I know this session is going to be available afterwards, and the Stroke Association Research has got an account from Jenny Plum. So yeah, those are really valuable.
I would like to add something. Online therapy is possible. if the person speaks English, we can do online sessions, online clinical work through the internet. It's a possibility. I also would like to say that intimacy and sexuality after stroke also depends a lot on how was it before the stroke, how was the intimate relationship before the stroke. But sometimes it may intimacy may improve, and I'm talking about emotional intimacy, sharing with the partner our own concerns, and intimacy is self-disclosure, private content with the other person, and feeling validated by the partner, and vice versa. So sometimes I observe that intimacy may improve after the stroke, but the partner needs to work on it. It's an investment as well, an investment.
Yes, I absolutely agree. And in line of the previous question, there is another question. Are there leaflets or information available? Obviously,
Yes,
in UK and Portugal, there are, right?
there are, yeah. And I mean, I know other countries do have them. I mean, check out what's available in your country.
You can check out here on the resources. We published on the resources some pamphlets.
Yes.
In Portuguese, we don't have many, but I work for a patient support organization, Portugal ABC, and we are working about it. Me, Dr. Ana Carvalheira, and the other board members, we are working on this subject.
Yes, okay. So all the resources that SAFE has will be published on the website of the Life After Stroke Forum. And we have one question more. This can be directed to Doug, to Anna, to Diana. So the question is the following. So stroke survivors may have lost their sense of self and struggle to see themselves as desirable. How can this be built up so the survivors start by finding themselves lovable again?
I don't know, maybe how I should answer. So it's I suffered my stroke 10 years ago, and I think that rehabilitation is for a lifetime. And I was not always a positive person. I think after the stroke, I was angry with the world. I didn't understand why that happened to me, and I was feeling the ugliest woman on the earth. But I had psychological support, and I talk about it with my husband, with my friends, with my doctors, and with myself. It's very important to talk with yourself and to find the answers for what the questions that you have in yourself, because when you don't understand yourself, when you don't accept the different person that you became after the stroke, you can't be happy, you can't give the step forward happiness. So it's all multidisciplinary rehabilitation. It's not only having physiotherapy, it's not only having occupational therapy or psychological. You have to have all of that, and then assume that the answers for your questions are inside you. That's
yes, thank you, Diana. And we have another question. What about same-sex couples? Is there information here? Doug or Dr. Anna, can you answer this? About same-sex couples.
Well, I think that most of the topics, most of the multi-factor aspects that we are raising here are common to heterosexual couples and same-sex couples. So we are talking about intimacy, we are talking about sexual difficulties, and all the other aspects, like the previous question related to the feeling of feeling desirable, feeling attractive. So we are talking about self-image, the new relationship with the body. We are talking about sexual self-confidence, self-esteem, difficulties with sexual arousal. We are talking about sexual pleasure. I would like to say the word pleasure, and not only, I think this is an important topic as well, not only sexual pleasure, but general pleasure through the body, through this new relationship that the person needs to rebuild. So all these topics, in my opinion, are absolutely common to heterosexual and same-sex couples.
Thank you, Dr. Anna. We have a lot of questions pouring in. However, we have to summarize our webinar. So we have actually come to the end of the session. I know it is a very interesting topic. And I would like to thank all the participants for the excellent questions that you posted. So obviously, we do not have any more time to answer the questions, but we will do so after the event. And this will be added to the resource center on the forum website. And now I would like to ask the audience to respond to our second poll of the morning and ask you again, how confident do you feel about having an open conversation about intimacy and sex? So while you do the voting, I can also say that as a healthcare professionals, we really do sometimes don't ask questions about intimacy and sex to our patients. We hold back. We don't ask delicate questions, maybe because of lack of time, because we feel that we might offend the patient, or the patient might feel embarrassed, or maybe we worry that we lack the appropriate knowledge to answer certain questions, and we do not want our patient to feel inhibited, guilty, or has no self-confidence. So sometimes it is why we do not actually consider these questions to ask to our patients. We ask, for example, about adherence to medical treatment. We ask about cognitive impairment, about depression, anxiety, pain after the stroke. But this is also a very, very important part of all our lives. So we need to address it as frequently as we can. And while I am waiting for the results of the poll, I would like to close this event by thanking everyone involved, our speakers, chair. Thank you, Professor Avril Drummond. You are wonderful as always. You're a true inspiration to all of us. I would like to thank our sponsors, Stroke Alliance for Europe, and of course, I would like to thank all of the participants. And now I'm seeing the results of the poll. So not at all confident, 20%, not particularly confident, 36%. So I suppose that now it has reduced to 12% after the second poll. Someone confident was 26% in the first poll, but now after the webinar, this has increased to 73%. Very confident were 13% in the beginning, and it has risen a little bit up to 17% after the poll. And only 2% answered that they have not considered it all. So I think that with our webinar and with the excellent presentations that we heard from our speakers, we managed somehow to tackle this important part of everyone's life. And you will also receive an email over the coming days that will ask you for some feedback to help us improve our events in the future, and also to let you know when the material is available if you want to see the material on demand and share it with your colleagues. And I'm really delighted and excited to see that this issue of life after stroke is receiving the European focus it deserves. And I hope that this really will change practice and we will see improvements how we deal with intimacy and sex after stroke. And finally, I'm very pleased to remind you about our next webinar. It will take place on the 29th of September and will focus on the emotional and psychological impact of stroke. So we will be in touch soon. See you at the next event, and thank you and goodbye.